Have you ever pondered about the inevitability of your own death? This unsettling thought process, known as thanatophobia or death anxiety, is a profound element of the human condition that has intrigued philosophers, artists, and psychologists for centuries. Death anxiety at its core is a dread or apprehension about the reality of dying and the uncertainty of what lies beyond. It's a complex, multifaceted experience that can manifest in a variety of ways. Some individuals may grapple with existential questions about the purpose or meaning of life. Others might struggle with the fear of non-existence or the concern of leaving loved ones behind. This anxiety often presents itself in the form of intrusive thoughts or fears that can disrupt daily life. It can lead to sleep disturbances, a preoccupation with illness or aging, or a pervasive sense of dread. For some, it might even trigger a full-blown existential crisis, causing them to question their values, beliefs, and life choices. But it's essential to understand that death anxiety is not a one-size-fits-all experience. It varies greatly from person to person, influenced by factors such as personal beliefs, cultural background, life experiences, and individual personality traits. Now let's distill the main points about death anxiety. Firstly, death anxiety is a normal part of the human experience. It is a natural response to our awareness of mortality. However, when these thoughts become overwhelming or interfere with daily life, it might indicate a deeper issue that needs addressing. Secondly, death anxiety presents itself in various ways, from existential questioning to sleep disturbances, and even to severe existential crises. The experience is highly individual and can be influenced by a multitude of factors. Thirdly, while death anxiety can be distressing, it is not necessarily a negative experience. It can serve as a catalyst for personal growth and self-reflection, prompting individuals to re-evaluate their priorities and live more fully in the present. Lastly, managing death anxiety involves acknowledging these fears, normalizing them, and seeking professional help when necessary. Cognitive behavioral therapy, mindfulness practices, and existential therapy are among the therapeutic approaches that can be helpful in managing death anxiety. So, the next time you find yourself contemplating the great beyond, remember, it's a journey we all must take. Fear of the unknown is a part of being human. It's okay to ask these questions, to ponder the meaning of life and death. It's okay to feel anxious. But remember, there are ways to manage these feelings, and there are professionals ready to help you navigate these complex emotions. In the grand scheme of things, death anxiety reminds us of the preciousness of life. It pushes us to live more fully, more consciously, and with greater gratitude for the present moment. So, while death is an inevitable part of life, it doesn't have to be a source of constant fear. Instead, it can serve as a powerful reminder to make the most of the time we have.